There are a number of ways that you can potentially tell that you might be due to start an antibiotic if you've had a cold for a long period of time. Usually it takes about 7 to 10 days, maybe a little bit longer, for a virus to start to change to a secondary bacterial infection. Secondary bacterial infections are things like sinus infections, throat infections, tonsillar infections, and ear infections. Sometimes people even get bronchitis or pneumonia that can also be a bacterial problem. Most infections start out as a virus, so antibiotics are not helpful. We can tell that a bacterial sinus infection isn't just a virus anymore if there's ongoing sinus pressure, it's not clearing, thick-colored or bad-tasting mucus. A throat infection would be ongoing sore throat that's not going away. A tonsil infection would be painful, swollen tonsils. An ear infection would be ongoing ear pain. Most ear infections are viral, and if we leave them be, they will go away on their own. Another clue is if you have a fever at the beginning of your illness, the fever goes away, the illness continues, and then you get a new fever. That's often a sign of a bacterial infection as well. I'd like to make a side note about strep throat, which is a severe bacterial infection that does need to be treated with antibiotics. It's usually a really bad sore throat, and it's typically not associated with the regular cold symptoms. It is often accompanied by tender lymph nodes, really swollen tonsils, some whiteness on them that's called an exudate or pus, and sometimes some abdominal pain, maybe fevers, chills, or headache. That's something you would need to call your doctor about. Bronchitis and pneumonia can become really serious infections that often do need antibiotics, but they do often start out as a viral infection as well. Sometimes not, it depends on your risk factors. This is usually accompanied by wheezing, a lot of coughing, mucus production, shortness of breath, low oxygen levels, and fevers, chills, sweats, or fatigue. Sometimes people have all of those symptoms, and sometimes they just have one or two. Make sure you call your provider if you're not sure. But for most healthy people, a cold will just taper off over the course of 7 to 10 days. If your cold is going on for longer than that, you may require an antibiotic. Hopefully this information cuts down on some emergency room visits and some quick care visits and calls to your doctor's office. If you ever have questions, don't be afraid to call your doctor. Don't forget to like and subscribe. What other topics are you interested in learning about? Best wishes in your health journey. Dr. Christine Blake Smith.